I'm happy to have Dr. Anthony Fauci with us tonight. He's the director of National Institute of Allergy and Infectious Diseases at the National Institute of Health. And I know, Dr. Fauci, you're distinct from the CDC, but because you're part of the team advising on this, just talk us through the process that produces this kind of guidance like the one that was released today.
Well, it's a realization of, relative risk. It has become very clear when you look at the data that's accumulated. And as I've said so many times, the CDC is a science-based organization, and they will likely and almost always make a decision or a recommendation based on either data or modeling or expert opinion. And the data became clear that the risk being outdoors is very low. If you are vaccinated, it's extremely low. So they decided, as they did when they made the statement and the recommendation, that vaccinated people indoors with another vaccinated person does not have to wear a mask and can have physical contact. There have been a lot of questions about what can you do outdoors. And it's very clear now, as you showed on the chart, Chris, that there are many things that common sense likely would have told you can do that have now essentially been codified, where you have an organization made up of the best epidemiologists in the world have come to the conclusion that the risk is so low that you can do the kind of things outdoors if you were vaccinated. And then you see on the other side of the chart, they contrast and compare it with things that you can do and then things that are a bit risky if you still are unvaccinated. So the message that I see in that, Chris, is get vaccinated. Get vaccinated, A, because it's going to protect you, protect your family, and help protect society. But also it'll open up for you the kind of things to know that you're doing them really quite safely. So it's a good thing all around what's been done. And then what you're going to see, Chris, is that as the weeks go by and more data are collected about individuals who are vaccinated, if they may get infected without symptoms, how low is the level of virus in the nasopharynx? Is it so low that they almost certainly would not affect someone else? You might see an upgrading of the recommendations to go even further. So this is another step in the right direction of how we can start getting back to normal.
I want to follow up and press on a question here, which I think gets at the root of some of the debate about this and some of people's uncertainty. Because it seems to me there's a distinction between what the science, the best that we have it, which is incomplete and uncertain in a changing world with a novel virus, right? But you can collect data and you can say, you could get a sense of what the risk is. Okay, the risk of this kind of outdoor activity is X, right? Some numerical estimate of your odds of getting the coronavirus. The question of what is tolerable risk isn't really a scientific question. I mean, that's a social question. That's a political question. That's a question for policymakers. The science can tell you what the risk is. The question society's answer is what's tolerable. And I think that the sort of balance between those two is really what is driving some of this debate about what we can and can't do. And I'm curious to hear you talk about that.
Yeah, I mean, I think you mentioned it a bit ago. When you talk about what I refer to as relative risk and what the level of risk that a person is, how risk averse is a person? In fact, you might have people, remember, and you said it at the top of the show, that these are really recommendations by the CDC. You know, there's not any policing or any requirement. They're recommendations. And there are some people who feel that the risk is so low that they would, in fact, go and take a step into that yellow or that red zone because they feel, as far as they're concerned, they're willing to take the risk. Nobody's going to stop them from doing that. But there's one issue that I think escapes many people, and it's worth mentioning, Chris, is that you don't live in a vacuum.
Right.
And we are trying to get an outbreak under control. So even though, let's say the hypothetical, I'm a person now who's vaccinated or not vaccinated, and I decide that I'm going to do something that is in a very red zone of what the CDC is saying. Because I say, I'm a healthy person. If I get the infection, it's very unlikely that I'm going to get seriously ill. Well, it doesn't stop with you.
Right.
Because if you get infected, you've got to realize that you may inadvertently and totally innocently infect someone else who might be a vulnerable person, who might get very sick. And also, you're propagating the dynamics of the outbreak. So try to look at it is that here's the risk according to what the CDC says, the data. If you want to vary on either side of that because you're either more risk averse or less, you can do it. But understand the consequences for yourself and for your responsibility to society.
And the social aspect of this, it also strikes me as very important, which is the base rate of transmission matters tremendously when we're thinking about risk, right? So if you were a vaccinated person, right, you say, you know, you're fully vaxxed. Do you want to be in, you know, the U.S. right now or India? Where would your odds of getting COVID be more, right? Like a place that has a lot of community transmission, you're gonna have a higher odds. We want to break the back of community transmission as a collective undertaking as part of this project.
Exactly. Chris, you hit the nail right on the head. And that's in fact.
I'm glad you said that because I couldn't tell if you were sighing with frustration with what I was saying or agreement.
No. I'm sighing in agreement, Chris, because that's exactly the point we're making. Right now, we have had for quite a while a 7-day average of about 60,000 new infections per day. Fortunately, and we predicted this, I predicted this last time you and I spoke, that if we keep getting people vaccinated every day, more and more people get vaccinated, you're going to see a turning around of that curve and the cases are going to start coming down. And in fact, over the last couple of days, it's been 30,000. Now, I hope that's a trend. I believe it is. So the lower and lower you get, that impacts the risk in the community. So if you're going out to a restaurant and you say, I don't mind the risk, I'm not that risk averse, and you're going out to a restaurant where there are 60 to 70,000 new infections per day versus going to that same restaurant when there are 15,000 infections, you have a much less of a chance within that framework of relative risk.
Yes. Now, I want to talk about kids because kids are an interesting outlier here. And like I said, I was able to take my two big kids to school, which was awesome. They have to mask in school, obviously. They can't be vaccinated. We don't have emergency use agreements for FDA approval of vaccines for kids under 16. So they can't be vaccinated. They have to mask, obviously, indoors. This question of like, what do we do with kids? How safe is outdoor play amongst kids? If they're masking or not at the playground, like, how should we think about that?
I think it's the same context that we just discussed about the level in the community. Right now, there's a level high enough that the CDC would feel very uncomfortable, as do I, about saying, no problem, let the kids go out without masks. Because we can say, and it's been said, and it's true, that children, when you talk about it statistically, have a much lower chance of getting infected to the point where they would get seriously ill. That's true, but they could still be part of the dynamics of the spread. So you don't want children to get infected, A, because you don't want them to get sick, even though it's a low chance that they will, but you don't want them to be part of the spread and the dynamics of the outbreak. You want to keep getting those numbers down. That's why we have children wearing masks when they're outside until they can get vaccinated.
You and I have talked about a timeline before, specifically around the thing that I missed probably the most of pre-COVID life, which is playing pickup basketball indoors with people. And we talked about the safety of that. You had at one point said, look, we're looking at winter of 2021, sometime in that November, December range that, you and I can maybe play a little pickup or, I could play pickup. I don't know. Depends if you're still game. Point being, are we closer now, given the rate that we've been vaccinating at? It seems to me like that was we vaccinated our way, that seems more possible sooner than it was when I talked to you maybe 6 months ago.
Absolutely. That, again, Chris, it gets back to the situation of why it's so important for as many people as quickly as possible to get vaccinated, because the more people that get vaccinated, the lower level. Right now, given the guidelines that the CDC came out, they clarified that if you're vaccinated and I'm vaccinated, we can play a pickup game tomorrow. I'll probably destroy you, but that's okay. But we could play a pickup game tomorrow.
famous Regis
kidding,
point
Chris.
guard, famous Regis point guard, Anthony Fauci, talking that trash, as I'm sure he did back on the mean streets of Brooklyn, the gyms of Regis High School.
Hey, thanks for watching our YouTube channel. You should know that you can follow today's top stories and breaking news and catch up on your favorite MSNBC shows all in one place. Download the NBC News app today.